So let's go over some of the benefits. We actually saw an impressive one now. First, of course, obviously to relieve pain. Doctor, let's take a look at a graphic here, some other benefits to having your hip replaced. So pain is a huge one. I'm going to guess that's kind of one of the main ones that people want to try to get rid of is they're having pain. Can you talk a little bit about what's left on the graphic there?
Well, getting the hip joint to work better has to do with restoring the mechanics. And once the hip is stiff from all this arthritis and extra bone that forms, it becomes a vicious cycle of pain and stiffness and not wanting to ambulate and walk and having difficulty exercising. But how do you get out of that cycle? And taking out the bad parts that the body's actually forming to protect itself and replacing it with new parts allows people to get up and start walking.
Right.
And the fixation nowadays is so strong, and the techniques that we use in order to control the pain with injections in the middle of surgery to help with local pain control, not just through pills and IV medication that can cause sedation. Patients are up and walking. Surgeries are being done on outpatient basis now. People can come in and out the same day with their hip or knee done.
That's amazing, because that's such a huge surgery. So I wish we could say that there was no risks involved with this, because there's so many amazing benefits, but obviously any surgery you're going to have some risks. We have a graphic showing now about some of the possible risks with this surgery. Can you go over the risks with us as well?
Yes, the reaction to anesthesia is better spoken with an anesthesiologist, which will be done through pre-admission testing once the patient and physician decide to proceed with hip surgery. The heart attack, again, depends on patients' comorbidities and other medical health issues. But if there's any risk factors, I tend to refer to the cardiologist or the internal medicine doctor, the primary care physician, who will coordinate care with all the other medical teams in order to stratify and place patients in different risk factors to say, is it safe? Patient safety is utmost importance regardless of the x-rays. And that's how I counsel my own patients.